Good afternoon, everyone, and welcome to our presentation of Stop the Bleed. In this 20-minute webinar, you will learn how to save a life in the event of an emergency. This educational program represents the joint effort of many organizations. We would like to thank the Committee on Trauma from the American College of Surgeons Committee on Trauma, the American College of Emergency Physicians, the National Association of Emergency Medical Technicians, and the Committee on Tactical Combat Casualty Care. This webinar and these slides represent the current best practice recommendations for how to manage a life-threatening bleed. Your speaker today is Izzy Lopez. Izzy Lopez is a field supervisor for emergency ambulance service. He is also a certified Stop the Bleed instructor. He has been working for 6 years in EMS. His dedication to EMS and Orange County community is unmatched. He is always educating himself on the newest and greatest techniques for pre-hospital patient care. The lay public course does not have graphic clinical photos. However, bleeding emergencies can be graphic, and the immediate responder will see a lot of blood. Managing your expectations regarding a bleeding emergency needs to be at the forefront of your mind. With that, I will now turn it over to Izzy Lopez. Izzy, good afternoon.
Good afternoon, everyone. Thank you for being here today. We're going to cover bleeding control and bleeding emergency. The number one cause of preventable death after injury is bleeding. Bleeding must be stopped as soon as possible. This training can be used anywhere, at home, in public spaces, out on a hike, at your place of work, or in the car. Many injury mechanisms can result in serious bleeding. While mass casualty shootings receive a lot of attention, serious bleeding is more likely to result from everyday injury. The techniques being taught in this course apply to bleeding regardless of the cause. The focus of this program is the immediate response to bleeding. Everyone should know how to recognize life-threatening bleeding. Everyone should be able to take the appropriate steps to control bleeding until help arrives. If you do not feel comfortable with controlling bleeding, you can still help by calling 911 and assisting others who are controlling the bleed. Your personal safety is an important consideration. If you become injured as well, you won't be able to help anyone, and you may yourself become a victim. The situation you find yourself in can become more complicated. If the scene is not safe for whatever reason, you should remove yourself and the victim, if possible, from danger and try to find a safe location. Once you reach safety, you can focus on the bleeding control then. PPE and avoiding contact with blood and bodily fluid. While the risk of transmission is extremely low, it's not zero. Wear gloves if you can. Avoid direct contact with blood or bodily fluid on your skin, eyes, or mouth. Wash hands after any contact, even if there is no visible blood. If you do get blood on you, make sure you clean any part of your body that the blood has touched, and tell a healthcare provider that you got blood on you and follow his or her direction. Over the next few slides, we'll go over the ABCs of bleeding control. The A stands for Alert 911. The 911 dispatcher will guide you through the conversation. What happened? When did it occur? Where are you? The number and status of victims, and any ongoing threats to your safety. It is helpful to know your location and to follow all instructions provided by the 911 operator. Life-threatening bleeding is defined as large volume bleeding that is continuous, pulsatile, like a sprinkler, or is enough to pool in clothing or on the ground. The faster we can control the bleeding, the better the patient will do. Even if you find one source of bleeding, there may be others. Clothing can typically hide life-threatening bleeds. The principles being taught in this course apply to external bleeding. This can occur from the extremities in blue and from the junctional areas in green, which consist of the neck, armpits, and groin. Junctional bleeding can be severe as large caliber blood vessels run through these areas. The third location where the bleeding can occur is from your body or torso. This internal bleeding into the body cannot be controlled in the field and requires rapid transportation to a hospital or a trauma center. Pressure will stop the majority of. Start with pressure. Use a small amount of gauze or material, just enough to cover the wound. Excess gauze or material makes pressure ineffective. If gauze is unavailable, use any clean material you can. You want to apply pressure directly to the bleeding site. The application of pressure may require a significant amount cannot afford. You want to apply enough pressure or force to stop the bleeding and continue applying until help arrives. The demonstration in this video is moving at a slower pace to show the process. A reminder that fast action must be accomplished to properly control bleeding. Here, the wound is being covered and pressed and held with pressure. This is considered pinpoint pressure directly onto the site of bleeding. This is an effective method of controlling. The C stands for compress or packing. If bleeding is from a cavity, superficial pressure may not work, and you may need to pack the wound deeply and tight. Be careful, as there may be sharp objects or fragments of bone within the cavity. Once the bleeding stops, do not check the wound. Simply hold pressure until help arrives. The demonstration in this video is also moving at a slower pace to show the process. I remind you once again that fast action must be accomplished in order to adequately control bleeding. Here we show the demonstration of packing a wound with gauze. The wound is being packed deeply and tight. You will know you've packed enough when it becomes firm to the surface. From there, you can take the excess and you want to apply pressure and hold. Again, compressed packing can be used on any of the extremities, the junctional areas, or the body and torso. Next, I want to talk about tourniquets. Tourniquets should be considered for extremity bleeding that does not stop with pressure or packing, or the situation does not allow you to maintain pressure on the wound. You can apply a tourniquet over light clothing. However, you should remove any bulky clothing such as a jacket. If being placed over a pocket, ensure the pocket is emptied first. Otherwise, the tourniquet may be ineffective. You can apply a tourniquet to others or to yourself. You want to place the tourniquet 2 to 3 inches above the wound. Continue tightening until the bleeding stops. 2 tourniquets may be required to achieve proper hemorrhage control. It is a painful procedure. Severe pain should be expected, and once the tourniquet is placed, you do not remove the tourniquet. The demonstration in this video is also moving at a slower pace to show the process. Faster action may be required in order to control bleeding effectively. You can see the tourniquet is being applied to this patient's arm, tightened down, and pulled across. You want to stop right before you get to the windlass for this type of tourniquet and turn the windlass until the bleeding has stopped. From there, you can place the windlass of this cat tourniquet into its holder, put the excess strap over the tourniquet, and then put the timestamp Velcro over that to secure it properly in place. Several tourniquet models are commercially available. The Committee on Tactical Combat Casualty Care, also known as COTCCC, or TCCC, is the resource the Committee on Trauma Stop the Bleed program utilizes for direction regarding equipment. Shown on the slide here are approved and listed tourniquets on the TCC's adjunct formulary. However, not every version of approved tourniquet is shown. There are several different tourniquets shown here. You have the CAT and soft T tourniquets, which use a windlass function. In the center, you have a SAM ratcheting tourniquet. Below that is the TX3 ratcheting tourniquet. And then to the right, you have the TMT and RMT tourniquets that have a quick buckle, pull, and ratchet system in addition to their wind. These are the recommended non-pneumatic limb tourniquets. The recommended pneumatic limb tourniquets are the Delphi EMT and the Tactical Pneumatic Tourniquet 2-inch. Bleeding control in children. Techniques to control bleeding in the child are very similar to what has been presented for adults. As long as they can be properly applied, the same tourniquet can be used in an adult or a child. If a child is too small for the tourniquet to be applied properly, direct pressure on the bleeding wound will almost always work to control bleeding. Wound packing is the same in both adults and children. Common concerns or frequently asked questions regarding impaled objects. Impaled objects should be left in place and not removed. The immediate responder can apply a tourniquet above the object. Professional medical personnel, fire, and EMS are trained to treat impaled objects. Improvised tourniquets. If a tourniquet that is approved is not available, an improvised tourniquet may be used in its place, such as a belt. They will not be as effective, however. Loss of arm or leg, referring to the fear that a tourniquet could result in the victim losing their arm or leg if the immediate responder places a tourniquet on the victim. Reassure them that placing a tourniquet on a victim will save their life and far outweighs the loss of an extremity. There are several studies available regarding length of time of tourniquet placement. Pain. Victims will experience pain with direct pressure wound packing, and tourniquet application. It is important to manage their expectations regarding all three techniques for controlling bleed. In summary, these are the basic principles that should govern your response. First, ensure your own personal safety before trying to help someone else by making sure that the scene is safe. Next, get help. Call or have someone call 911 for assistance. Make every effort to assure help is on the way as you proceed. Look for any source of bleeding or multiple sources of bleeding. And then once you have located the source, control the bleed with the application of direct pressure, the packing of a deep wound, the application of a tourniquet, or a combination of all of these techniques, and then wait for help to arrive.
Thank you so much, Izzy. Great stuff as always. For more information or a repeat of the information you just heard, please visit stopthebleed.org. Stopthebleed.org has the latest and greatest and newest possible information regarding stopping the bleeding. Remember, the only thing more tragic than a death is a death that could have been prevented. At this point, we encourage you to follow us on Instagram. We are at Emergency Ambulance, no spaces, and we will give you about 30 seconds to post a question to us. We'll give you 30 seconds, and Izzy will tell a 30-second story about a time he used a tourniquet. Izzy?
Yes, indeed. There have been several calls in the past where I've had to use a tourniquet. Namely, a gentleman had cut into his arm with a skill saw on a table. The bleeding was not able to be controlled adequately with packing or with pressure. We applied the tourniquet directly above the wound, about 2 to 3 inches. He did experience sharp pain. However, the bleeding ceased and we got him safely and stably to the hospital.
Izzy, I am not understating it when I say you are a hero. All right, that was 30 seconds. We see no questions, so we are going to be stopping this webinar. We thank you all for joining us this afternoon. We understand that it's hard to find 30 minutes in the day to learn a new skill, but you took the time and we appreciate it. Again, if you have any questions, you can contact us through our Instagram page, which is at Emergency Ambulance. Thank you all so much for joining. Take care.